Today I will be talking about the critical care pain observation tool. It's a tool used to assess and measure a patient who is ventilated to see if they're in pain because they can't vocally tell you. And how this works is that you will be, or I will be, observing the patient at rest for a minute to see if they have any facial changes in facial expression, body movements, and muscle tension that indicate that they might be in pain. And so I'll be looking at them for a minute, and then after a minute passes by, I will do a passive range of motion test on their hand, where I will hold their elbow and hold their hand and do a flexion and extension. And to test by this, I will try to look for any facial expressions, body movements, and muscle tension to see if they're experiencing pain when I move them. And Anna didn't exhibit any of these, so then we'll move on to the next half of the assessment, which is observation of the patient when I'm turning them. And what you do is you log roll the patient, and as you do this, you're going to look out for the same three things, which is facial expression, body movement, and muscle tension, to see if any of these occur. That means that they might be that there might be pain. So what I'm gonna do is log roll to the side, and her body is in a flaccid tone. There isn't any tension. There's no movement of her arms or legs, and there is no facial changes in her facial expression. And there's one other thing that they assess, which is the compliance with the ventilator, because these patients are intubated. If the intubator is working normally, then there isn't any problems. But if they're like coughing but it's tolerated, you would rate that as a 1. And if they're fighting with the ventilator, then that's a 2. And so the other three indicators that I'm trying to assess, which is facial expression, body movement, and muscle tension. It's also on a scale of 0, 1, and 2. 0 being relaxed and there's no pain, 1 is mild pain, and then 2 is indication of pain. And for facial expression, if there's grimacing, that's a 2. If there's like slight tension in their face, that's a 1. For body movements, if there's like restlessness and agitation, that's a 2. If there's like protected movements or like reaching towards areas of where they feel pain, that's a 1. And for muscle tension, if they're very rigid and tense, that's a 2. They're slightly tense and rigid, that's a 1. And for a 0 for all of them means there's like no movement or expressions. And that's it.